Isha, only on Radio Zindagi. And COVID के पहले, ऐसा नहीं है कि हम बहुत चीजों से नहीं struggle कर रहे थे. We were struggling with demons even before COVID, and demons like cancer. जो आज भी कोई pause लेके नहीं बैठा है, आज भी there are people who are struggling with it. There are cases, there are treatments going on even when COVID exists. This is the reality. This is the situation we live in. And around, they say in 2030, cancer may affect 130 million Indians. And of course, the larger majority is people who are disadvantaged. The backgrounds are not so, very humble backgrounds. So for today's episode, I got this amazing lady, जिन्होंने 19 साल की उम्र में आरोग्य फाउंडेशन की वो फाउंडर बनी, CEO बनी, and she started this foundation at 19 years old. A lot of people, when they're 19, including myself, we think about ourselves, हमारा करियर क्या होगा, हम क्या करेंगे, पर उन्होंने इस बारे में सोचा. She's a doctor turned entrepreneur, she's an innovator, और ये पूरा फाउंडेशन जो है वो काम ही इसलिए करता है कि अर्ली डिटेक्शन ऑफ कैंसर, कैसे लोगों तक इसका अवेयरनेस पहुंचाया जाए ताकि वो इस चीज को समझे, और हो सकता है कि इस वजह से कितने लोगों की जान बच जाए. क्या इस मेडिकल फील्ड में होता है, कैसे टेक्नोलॉजी इसमें हेल्प करती है, कैसे आरोग्य इस फील्ड में जो है हेल्प कर रहा है लोगों की, नॉट ओनली जस्ट इन इंडिया बट इंटरनेशनली. व्हेन यू गो टू देयर वेबसाइट, लुक एट द पैनल, people are from UK, people are from Stanford. It's just amazing what she's doing right now. So let's welcome Priyanjali Datta, Dr. Priyanjali Datta, to our show. Let's ask her more about Aaroogya Foundation. And if you want to go and visit the website, it's aaroogya.org. So go and you'll find out every information on the website. How are you doing, Dr. Priyanjali? Welcome to Radio Zindagi.
Thank you. Thanks a lot, Isha. I'm doing good. Thanks a lot for having me here today with you. It's a great pleasure. And I love the work that you guys are doing. So happy to be here today.
I love the work you are doing. I mean, it's our pleasure actually to have you on our show. Dr. Priyanjali, I'm going to ask you, at 19, you were thinking about this cause, this foundation. How come? What pushed you that you want to do it? And I'm sure आप 19 साल में तो डॉक्टर भी नहीं बनोगे. आपने सिर्फ एक सोचा होगा कि डॉक्टर बनना चाहती हो. So please do tell us about that.
Sure. So when I started my education, I was somewhere around 18. And when I started Aaroogya, I was somewhere around 19 in my college. And I started this because हमारे college government college है. And वहाँ पर जो इंश्योरेंस के थ्रू अंडर प्रिविलेज्ड हम्बल बैकग्राउंड से लोग आते हैं, वो लोग ट्रीटमेंट कराते हैं. गवर्नमेंट उनका इंश्योरेंस पूरा करती है. एंड वी सॉ दैट इन दिल्ली पेशेंट्स आर कमिंग फ्रॉम राजस्थान, मध्य प्रदेश, गुजरात, हरियाणा, पंजाब, हिमाचल प्रदेश, everywhere, and they all are coming very late when the symptoms have become very, very severe in every disease, not just cancer. And especially women जब आती थी हमारे यहाँ पे, तो उनके breast cancer, cervical cancer, oral cancer, सारे ही stages बहुत late होते थे. The best case scenario we would found is in stage 3, which is already too late. So it used to really, bother me a lot because my nani passed away of lung cancer. And at that time, I was very small and she was very young, the most passionate and happy and, alive woman I saw. And one fine day, it was like, oh, she just has got hardly 3 months. And it was a shattering moment for me. So I used to keep imagining that, is cancer so complicated that people have to die all the time? And I started digging a lot in it. And I used to run after my professors and ask all my patients कि आपको शुरू में कुछ लगा, कुछ हुआ? Nothing. कुछ उन्होंने notice ही नहीं किया. फिर मैं बहुत US और UK के cases research करने लगी, Sweden के cases research करने लगी. And I saw कि 7 out of 10 women in these countries live and they come out of the disease.
Okay.
Because they are coming in early stages. और उनका regular screening होता है. Every 6 months or every once a year उनकी screening programs है. and that's why they get detected early. So that was one thing which was bothering me a lot, and I knew that I will not be a doctor who will be bounded by only clinical practice. So I was constantly looking out for that, problem.
Yeah, that's amazing that you thought about it. But like you said about symptoms, इसके symptoms कैंसर ही एक ऐसा मुझे लगता है जिसके symptoms समझ ही नहीं आते लोगों को, या फिर उसमें पेन नहीं होता तो लोग डिटेक्ट नहीं कर पाते हैं. तो आप ये जो early detection का बोल रहे हो, how should people be concerned? Like what are the low risk, what are the high risk? What do you tell people when you do camps or when they come to you?
Right. So Isha, we what we do is typically there are many midwives like ANMs and semi-skilled health activists like Asha workers in India. And वो लोग already community में कितना deeply penetrated है. 70% of at least India's population is rural, and this entire scenario mimics across many developing nations in Africa and South America. तो ये जो मिड लेवल हेल्थ केयर वर्कर्स है जो डायरेक्ट कांटेक्ट में है कम्युनिटी के साथ, ये मैटरनल एंड चाइल्ड हेल्थ का ध्यान रखते हैं, इम्यूनाइजेशन का ध्यान रखते हैं. सो दे आर ऑलरेडी गोइंग डोर टू डोर. नाउ अवेयरनेस फैलाना और इग्नोरेंस को रिमूव करना इज अनदर बिग चैलेंज which a lot of people are trying to solve. But that early detection will and only will come with regular screening, easy screening. Ab 70% of India's population can't rush every 6 months or once a year to cities for getting their breast ultrasound done or pap smear done. They have to be given a very very easy solution. तो ये जो हेल्थ केयर वर्कर्स हैं, ये लोग ही हमारे एम्बेसडर्स हैं. इनको हम मोबाइल एप्लीकेशन, वेब पोर्टल और डैशबोर्ड के फॉर्म में AI enabled symptom assessment देते हैं, which is very easy for them to conduct screening with. And हमारे डॉक्टर्स जो है वो फाइनल रिपोर्ट बना के उनको भेज देते हैं. जो भी हाई रिस्क केसेस होते हैं, high risk cases are mostly those cases. I'll give you two scenarios where if a woman who has got married very early and has kids at a very early stage, so or have does not have a very privileged background, so her lavatory or toilet conditions are quite unhygienic. So cervical cancer के chances होते हैं उनमें more than us who are in cities.
Okay.
Similarly, in women who have got married late and have children from a late age, तो उनकी breastfeeding late हुई है या वो काफी मोटे हैं, if they are very obese, so the fat cells and estrogen causes very high chances of breast cancer.
Okay.
So what we call Dr. Pramod Kumar Julka, जो dean के dean थे AIMS में, he was ex-dean and he's one of the pioneer Padma Bhushan, Padma Shri awardee. He says that estrogen is the main culprit. जो ये female hormone है, ये main culprit है. If you are obese or if you're taking hormonal therapy pills or if you're taking a lot of stress which causes increase in release of these hormones, तो ये disease के chances बहुत बढ़ जाते हैं. Stress is a very big factor.
Yeah. When people say don't take stress, you just take it very lightly, but that is actually, you have to stress on on that line that don't take stress. Okay, we got you back.
Yes. Yeah.
Also, I wanted to ask you, especially India or let's say developing countries, यहाँ पर early detection कराना कितना ज़्यादा ज़रूरी है आपके हिसाब से?
Sure. So Isha, यहाँ पर statistics अगर हम देखें, like you said initially, that WHO has already released the fact that 1 out of 10 Indian may have cancer by 2030. And top 3 cancers will be oral, breast, cervical cancer, which affects women largely.
Yeah.
तो वहाँ पे ऐसे देशों में तो अर्ली स्क्रीनिंग के अलावा, वरना जीडीपी विल गो with COVID और भी खराब हो गया, but GDP will go for a toss because this is a silent pandemic. And ऐसे countries में easy methods देना जो technology से embedded और enabled हो, क्योंकि technology can go wider than physical buildings and it can go faster. So it's very important कि innovations, more and more innovations for very easy methods of screening hand over किया जा सके already existing healthcare workers को. क्योंकि new force of healthcare workers तो बनते रहेंगे, that is also needed equally. But right now, to catch the problem, to act, we have to be more innovative, very innovative in such a large country.
Yeah, so especially women are getting affected by it largely. So early detection is so important at this stage.
Most.
And you guys are doing a wonderful job. I know Dr. Priyanjali, क्या होता है कई बार लोग जब किसी की कहानी सुन लेते हैं ना, they get more either inspired or they feel like there's hope. So इस situation में मैं आपसे पूछना चाहूंगी, कोई आपका ऐसा patient जिससे early detection की वजह से किसी की जान बच गई हो? Because like you said, early detect हुआ तो जान बच सकती है. Nobody can die. So please share us if you have any story.
Sure. I have a very interesting story from a patient in Buxar, Bihar. Buxar is a very, very historical place, but very remote in Bihar. And it was our team's first time when we started working in Bihar. We started working with Central Ministry of Health and Family Welfare there. Okay. And we got to design and work very nicely. So we were very happily spending a couple of months there, and we reached out. So we have a layer of implementation called Aaroogya Research and Public Health Fellows, who train these healthcare workers on our mobile application and AI tools on how to screen. So one patient one day came, and actually the son came running to us, and he somehow thankfully encountered me, and he said that can you please look at my mom's problem? She is not able to stand, and she has this problem since years, but she told us some months back. I said, okay, what's the problem? So he said, no, I don't know, I can't say, my mom doesn't say, but वो गिर जाती है, she just faints, and she just says कि मेरे पीठ में दर्द है. That's all. Okay. I said, okay, you bring, I felt really bad that, okay, fine, there's a huge queue of women, but we'll take you from the back, because you look really distressed. So I took that patient from the back, and she was pretty okay, 50 plus lady, and she was so thin, and she was really not able to walk properly. So I handed over to our doctors who were screening and healthcare workers, and I went to do some other work. I got relentless calls from that camp, and I had to rush back, and everyone was panicking. The whole team was panicking inside that particular camp. Okay. And I got a huge pungent smell. Like, the moment I entered, I felt like, very bad infection. And I saw that her entire, so we have a documentary movie also coming up on this. Okay. She had a huge portion of her right breast already gone. It was, pus and blood coming out. Her right breast was, I think, 5 to 6% left. Nothing was left. Her bones were visible. So we asked her that, my doctor who was conducting, she got very overwhelmed emotionally, and she almost felt her BP is low. So I started doing the screening. After her screening, I said, Amma, आपने ये किसी को बताया नहीं? So she's like, हाँ, मेरे husband है नहीं, और मुझे 3-4 साल से यहाँ पे कीड़ा लगा हुआ है. and मुझे पीठ में दर्द होता है. That's all she used to say, कि मुझे पीठ में दर्द होता है. And I said, आपने कभी किसी डॉक्टर को नहीं दिखाया? उन्होंने कहा डॉक्टर तो है ही नहीं, यहाँ आसपास कहीं डॉक्टर तो है ही नहीं, मैं कहाँ किसको दिखाऊं. और बेटे को बोलने में बुरा लगता है, और you know how humble Indian families are. And we immediately, thankfully, AIMS director was there on that day, along with Governor of Bihar, and everyone was inaugurating. In fact, ex-Health Minister JP Nadda was also there, and we could quickly respond and send her to AIMS Patna. And she was detected with stage 2, thankfully, with such an aggressive breast cancer.
Yeah.
So, this is one story, and this is a true story which made the whole team very emotional, because we keep talking about things, we keep talking about ignorance, unawareness, and death, and what a family goes through, but when you see it and you realize, okay, oh my god, yeah. So that was a story that I can't forget ever.
I don't even have words. I'm getting emotional. It's like,
yeah.
Is she okay though? Like, what's her current? Okay.
Yes. Thankfully, she was diagnosed in stage 2, and because of her infection in that area, she had some blood loss. But thankfully, that was pre-COVID, by the way. And we all could, get her some blood, and yeah, she's doing well now.
So that's why early detection is so important. That's why you emphasize on this, and that's why the whole foundation is trying to help, especially women, understand. And like I said, cancer ne pause nahi le liya just because COVID came in, right?
Correct.
There are treatments still going on. What do you think is the current situation right now, because COVID has started? I know you're already on roads. I know you're helping people in this pandemic also. So what's the situation like? Kaise handle are people coming out? And also I want to ask you, after you answer this question, why do women don't tell? Why there is this thing of hush, not telling people that they have cancer? Like, why is it? What is the reason behind it?
I think, Isha, coming to your first question, that pandemic is going to show its impact over next few decades. This 1 year has damaged us to a level where TB cases are rising. The healthcare facilities are extremely overburdened. They are not getting treatment. Cancer cases are rising more. क्योंकि एक तो अर्ली डिटेक्शन का कोई कॉन्सेप्ट था ही नहीं, ऊपर से अब किसी को कराना है तो वो भी जाके स्क्रीनिंग नहीं करा पा रहे हैं. People are unable to. Even women like us are not able to go and get their screening done. And so it is going to show a very bad impact, really bad impact. So at this point of time, at least all the women, because this is linked to your second question, that our private areas are quite sensitive, and women in India hardly look at herself in the mirror. And when we quickly take bath, we hardly think about, is there something wrong, or am I feeling something? We put our health secondary and our family first. So hush hush का जो concept है वो इसीलिए है क्योंकि हमसे जो 1, 2, 3 जनरेशन के ऊपर की भी जो women थी, they always prioritized their families, their kids, and their education and food above their own health, which is quite normal, which is obvious. But ये इसलिए भी है क्योंकि family also play some role in ignoring her health.
Right.
Like we always feel that the woman who's working in the house, उसको क्या हो सकता है? वो तो कुछ वो तो कहीं कुछ जा नहीं रही है, कुछ कर नहीं रही है. So people fail to see and be empathetic towards each other in their family, and ignorance keep building up, and one fine day we meet the monster. So I think a community, a very strong community of women is very, very much needed,
Yeah.
important, and a circle of...
People are like, don't tell anybody that that person has. Why is that? I don't understand. It's not their fault. It's nobody's
Yeah,
fault.
it's not.
So why then there's the, you know what I mean? Like there's a thing that
Yes, yes.
this. I'm glad that, people who are like celebrities or they come out and when they tell, they feel like, theek hai bhai.
Yeah, correct, correct. I have a patient story. She is a young girl from a Delhi University college, a reputed college. And she told me once that, and she's a class representative, very active, alive, beautiful girl. She came and told me that, can you please do my screening? I can't go to a doctor and do it. My mom will scold me. I said, why? I said, where are you from? First of all, tell me. She said, I'm from Patiala. It's a very small place in Punjab. And I have this huge lump, literally this huge lump, because I saw it when I screened her since I was in ninth standard. So for 7-8 years, her mother didn't let her go to a doctor क्योंकि पटियाला में छोटा सा community है तो पता चल जाएगा तो बेटी की शादी नहीं होगी.
Oh my God.
You know, thankfully that was not cancer, but there's this unexplainable thought process, which is dangerous.
It is dangerous. Oh my God. No, please go for screenings. Please let your kids, especially if you have a girl kid, let them go and just go and reach out. Help is always there and people want to help. Like you guys,
Yes.
you want to help them out and you want to make sure that, life बढ़ सके. मैं एक
Yes.
बार बस आपसे पूछना चाह रही थी, I know you guys do such a wonderful job on this, early cancer detection. Because COVID के बीच में, since you are into medical help and you're helping people out, COVID में आपने कुछ ऐसा आपको लगा कि this is one thing you should do and this is one thing आप help कर सकते हैं लोगों की?
Sure. Actually, my co-founder Dr. Dhruv Kakkar, he is from Johns Hopkins University. तो वहाँ पे काफी research चल रही थी COVID को लेके, and he was very, very, scared because this pandemic was going to become pandemic, and a lot of researchers knew it since early December, January, and we knew that okay, if India में आ गया, तो India में तो 130 plus 140 crore लोग हैं, 1.3 billion people, and India में आ गया तो it will not be a disease of cities. The infection will spread to the rural areas, and unemployment की वजह से लोग वापस जाएंगे, जो अभी भी हो रहा है. Migrants are going back home, so they are carrying infection to the places where there is no healthcare.
Yeah.
Right? I mean, nothing at all. So that was coming, and hence we could repurpose and respond quickly with a consortium. We first of all, we built our tools around COVID in our existing software systems. And we quickly reached out to, it was such a moment of, where you need real collaboration, that real human pact and survival instinct. We reached out to many organizations. We were incubated with the Nudge Foundation, which is amazingly, working for India's poverty. We reached out to IntelliHealth, which is again Maryland-based international NGO. We reached out to 23 such organizations like Goonj, Pratham. And we made a consortium of 23 social and technology organizations with Pro, Infosys, everyone. Okay. Then we could reach out to these organizations who are already in various cities and states and villages and give them the technology, helpline number, the web applications, web portal, live dashboards, everything for contact tracing, for COVID-19 screening of, these migrant workers who are moving back to their places. And we could reach somewhere around 150,000 such families, thankfully, with the help of the consortium. So that could happen very well. We also knew that, COVID-19 की testing हर जगह available नहीं होने वाली है, because very less places have hospitals.
Yeah.
Like
Yeah.
Jharkhand has just one testing center in the whole of Jharkhand.
Oh God.
So, अब धीरे धीरे बनेंगे, but by that time the damage is huge,
Yeah.
which is done.
Yeah.
So, we did as much as we could, and we are still doing. And we also added some more modules of TB and typhoid and some infectious diseases, because ये लोग बहुत सफर कर रहे थे. हमारे हेल्पलाइन नंबर पे women health का, menstrual hygiene का और TB से related भी बहुत calls आ रहे थे from places like Bihar and Uttar Pradesh. So that was also an issue.
Okay. So Dr. Priyanjali, before we wrap up, I have to ask you this: कि कितने time में a woman should go and go get a screening done, and if someone wants to reach out to our Aaroogya, if they want to do something, what can they do? How can they help you guys?
Sure. So for all the women out there, you should definitely at least go once a year for your screenings. Not missing that, for just like you don't miss your most important thing in life, maybe a birthday celebration. Just treat yourself like a queen on that day and go and do your screening no matter what. Decide a date, and every month do self-screening. Do observe your body just once. Fix a date after your cycle, when the date ends, and spend some time, half an hour. That I think half an hour is not a big thing for your own life. And if you definitely want to reach out to us, we have many meetings that we do in California time regularly every month, where you can come and join the meeting. We talk a lot. People help in various ways, not just by donations, but also by giving their time, resources, and advice. So we love talking to people, and anytime you want to reach us, you can go to www.aaroogya.org. Aaroogya is AAROOGYA. And you can also write to us on info@aaroogya.org.in. So,
Amazing.
yes, that's.
So do that, people. If you're listening to us, watching us, go to www.aaroogya.org. And like I said, they want to help you. So don't feel shy to reach out to them. They are surely, like I said, it's not just, it's not just national, it's international. Like, you guys are globally helping people out. So thank you so much, Dr. Priyanjali, for talking to us. What a wonderful cause. And I'm sure कोई भी सुन के इसको अगर एक बार स्क्रीनिंग पे चला गया, so I think our work will be done. So
absolutely.
Thank you so much for our time. I know you're on roads. Take care and be safe. Like, I don't have to tell you you're a doctor, but
no, we all need to hear that from each other. Always.
Thank you so much. It was such a pleasure talking to you. And you guys,
thank you.
Yeah, you guys just go and visit aaroogya.org. Thank you for listening. Keep listening. See you.